So he was 1.5. He loved the sound of running. He loved to run. So when he was running around the house that night and I would hear his feet, and I just knew if I kept hearing his feet, everything was okay. I had supper going, I had the oven on. I remember leaning down to help one of my children with their math homework, and I remember thinking, I don't hear his feet anymore. The next thing I knew, I was hearing him kind of whimper, and then it turned into a really big cry. I turned around and I saw him. He had the oven pulled down. Both hands were on the inside of the oven, and I just remember bolting to get him, and I scooped him up right before he almost fell in. And so that's where it all started.
We are Andru and Jenny Bramblett.
And JB is our son. His little hands were bubbling up with blisters, they were bursting, there was blood dripping down. At that point, I knew I had to get to USA Children's and Women's.
You know, knowing my wife was driving 40 minutes to the hospital rather than going to the nearest hospital 5 minutes away, there's a little trepidation about that, and wondering, is she making the right decision?
They have always had an amazing reputation with treating children, but I knew that they also had an amazing staff of pediatricians that would specifically know exactly what to do with JB. I grabbed him, I ran inside, and I just remember that feeling of hearing him scream and cry, and all of a sudden, this intern, she was in the room with me. She grabbed my shoulders, JB was in the bed, and she said, it's gonna be okay. He's gonna be okay. And all I could see were these huge blisters on this little boy's hands. And she said, look, I'm okay, it's okay. I'm one of 5 children. The same thing happened to me when I was a child. She said, you can't have your eyes everywhere. He really is going to be okay. She's like, look, my hands are great. I'm going to be a surgeon. And all of a sudden, it was just like this peace transcended over me, and I could focus. I knew I was going there for the best care, but what I got was that. And that really, that changes everything.
It's very important from our perspective to address the needs of the entire family unit. And that means obviously taking care of the sick or injured child, but at the same time meeting the needs of mom and dad and the siblings who are all obviously impacted by the health events that have happened.
You have all these dreams for your son, and then you're in a situation where you don't know if those dreams will be dashed. So I feel like they provided hope, which was more of what we needed in the moment than just care.
We didn't have one complaint. There was no one that made it uncomfortable or said anything that made us feel like we couldn't be a part of his healing and his process, that we were there.
We want every kid that has a problem together.
Yeah, you want your friends and your family to know that place is amazing.
To me, it's absolutely clear that a pediatric hospital and a pediatric emergency department can have a huge impact on the quality of care that's delivered. We see close to 40,000 patients a year, and my goal is to be part of creating one of the best pediatric emergency medicine programs in the country. And we're well on our way to doing that. I'm just saying, just watch, you'll see.